Good evening. My name is Alex Espinoza, and I'm going to talk about glycemic control and excess mortality in type 1 diabetes. Definition. Type 1 diabetes is a serious condition where your blood glucose level is too high because your body can make a hormone called insulin. This happens because your body attacks the cells in your pancreas that make the insulin, meaning you can't produce any at all. We all need insulin to live. It does an essential job. It allows the glucose in our blood to enter our cells and fuel our bodies. As you can see here, we have a picture demonstrating how does type 1 diabetes attacks our cell. Here you can see glucose, and here you can see the insulin, and here's our cell. The job of the insulin is to make the glucose enters the cell so it can function the way it's supposed to function. Here we can notice that all the glucose is outside the cell because there's no much insulin to make the glucose enter the cell. So the pancreas does not produce so much insulin, so the glucose doesn't enter the cell. Applications in medicine. The excess risk of death from any cause and death from cardiovascular causes is unknown among patients with type 1 diabetes and various levels of glycemic control. Observational study. We conducted a registry-based observational study to determine the excess risk of death according to the level of glycemic control in a Swedish population of patients with diabetes. Methods. For each patient, 5 controls were randomly selected from the general population and matched according to age, sex, and county. We included in our study patients with type 1 diabetes registered in the Swedish National Diabetes Register after January 1st, 1998. Patients and controls were followed until December 31, 2011, through the Swedish Register for Cause-Specific Mortality. Diagnosis. Glycated hemoglobin test. This blood test indicates your average blood sugar level for the past 2-3 months. It measures the percentage of blood sugar attached to the oxygen-carrying protein in red blood cells. An AIC level of 6.5% or higher on 2 separate tests indicates diabetes. Experiment. Random blood sugar test. A blood sample will be taken at a random time and may be confirmed by repeat testing. Blood sugar values are expressed in milligrams per deciliter or millimoles per liter. A random blood sugar level of 2000 milligrams per deciliter or higher suggests diabetes, especially when coupled with any of the signs and symptoms of diabetes such as frequent urination and extreme thirst. Results. A blood sample will be taken after an overnight fast. A fasting blood sugar level less than 100 milligrams per deciliter is normal. A fasting blood sugar level from 100 to 125 milligrams per deciliter is considered pre-diabetes. If it's 126 milligrams per deciliter or higher on 2 separate tests, you have diabetes. Pros and cons. Pros. The pancreas secretes insulin into the bloodstream. Insulin circulates, allowing sugar to enter your cells. Insulin lowers the amount of sugar in your bloodstream. As your blood sugar level drops, so does the secretion of insulin from your pancreas. Cons. Heart and blood vessel disease, nerve damage, neuropathy, kidney damage, nephropathy, eye damage, foot damage, skin and mouth conditions, and pregnancy complications. Conclusion. The goal is to keep your blood sugar level as close to normal as possible to delay or prevent complications. Generally, the goal is to keep your daytime blood sugar levels before meals between 80 and 120 milligrams per deciliter, and your after meal numbers no higher than 180 milligrams per deciliter 2 hours after eating. Thank you very much. Right now, I have uploaded three types of videos talking about type 1 diabetes that I'm going to show you right now.
About 10% of people with diabetes have type 1. It's got nothing to do with diet or lifestyle, it just happens. When you have type 1 diabetes, your body attacks the insulin-producing cells in your pancreas, so you can't produce any insulin at all. And we all need insulin to live. It does an essential job. It allows the glucose in our blood to enter our cells and fuel our bodies. When you have type 1 diabetes, your body still breaks down the carbohydrate from food and drink and turns it into glucose. But when the glucose enters your bloodstream, there's no insulin to allow it into your body's cells. More and more glucose then builds up in your bloodstream. So what does this mean? Well, before diagnosis, your body tries to get rid of the glucose through your kidneys, and that makes you wee a lot. Weeing so much leads to another symptom of diabetes, extreme thirst. Because glucose can't enter your cells to give you energy, you'll feel incredibly tired. To try and get energy, the body breaks down fat stores to provide fuel. That's why people often lose weight before discovering they've got type 1 diabetes. These symptoms tend to come on quickly, over just a few days or weeks. Anyone who has these symptoms should see a doctor as soon as possible. If you've got type 1 diabetes, you get insulin into your body by injecting it or using a pump which delivers a constant supply into you. You'll also need to check that your blood glucose levels are not too low or too high by using a blood glucose testing device several times a day. When you start taking insulin, you'll begin to feel better, and your blood glucose levels will go down. This is important because over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. These are known as the complications of diabetes. But with the right treatment and care, the long-term effects of diabetes and high glucose levels can be managed. You can find out how we can help you manage your diabetes on our website. We're still not sure why some people get type 1 diabetes and others don't, or why the immune system of someone with type 1 attacks the cells that produce insulin. But our researchers are learning more and more about type 1 diabetes, so we can develop new treatments and one day find a cure. About 10%.
Now I'm going to show you the other video.
Type 1 diabetes is a condition in which the pancreas produces little or no insulin. Insulin is a hormone that helps your body use blood sugar, known as glucose, for energy. Your body takes the food you eat and breaks down fat, protein, and carbohydrates for energy. While your body is digesting the food, the carbohydrates are broken down into glucose. The glucose is then absorbed into the bloodstream, where it is carried to cells throughout your body. Insulin helps your cells absorb the glucose in your blood, allowing it to be used as energy. A healthy pancreas releases a regular supply of insulin into your bloodstream. After you eat, your blood glucose levels rise, and your pancreas responds by releasing more insulin to move the glucose into your cells. Insulin acts as a key, opening up the cell so it can accept the glucose. In a person with type 1 diabetes, the pancreas produces little or no insulin. Without insulin, blood glucose levels rise. Without insulin, glucose cannot enter the cells and be used for energy. As a result, it remains in the bloodstream. As a person with type 1 diabetes, it is important to monitor and maintain healthy blood glucose levels. High blood glucose levels over a long period of time can lead to health complications. If your blood glucose level drops too low, even for a short amount of time, you may feel dizzy or too hot or cold. If your blood glucose level drops extremely low, you may lose consciousness. By taking insulin as prescribed by your doctor and maintaining a healthy diet, you can keep your blood glucose levels within a healthy range.
Right now, I'm going to show you the third and last video.
To understand what diabetes is, let's begin with how the body uses the energy from food. Sugars, also called carbohydrates, come from the foods we eat. We digest the sugars, which circulate in the blood in the form of glucose. The presence of glucose in the blood causes the pancreas to produce insulin. The insulin acts like a key, allowing the glucose to enter the cells. The cells, like muscle cells, for example, then use glucose for energy. Insulin also enables the liver to store glucose. This glucose in the liver is released and used by the body for energy between meals and overnight. In people with type 1 diabetes, the pancreas no longer produces insulin. These people must therefore inject insulin to survive. Injected insulin allows glucose to enter the cells and be used as energy. If there's a lack of insulin, glucose builds up in the blood. This results in an abnormally high level of blood glucose, which we call hyperglycemia. The symptoms of hyperglycemia include thirst, frequent urination, and fatigue. Over the long term, hyperglycemia can cause damage to the eyes, kidneys, nerves, blood vessels, and heart. Sometimes, for different reasons, there can be an abnormal drop in blood glucose levels, which we call hypoglycemia. The symptoms of hypoglycemia include trembling, palpitations, and sweating. To keep their blood glucose at normal levels, people with type 1 diabetes must constantly find a balance between their lifestyle habits and the amount of insulin they inject.
Thank you very much. I hope you liked my presentation. Have a good evening.